Hello everybody, this is Ahmed Abdulmazid, plastic surgeon and the founder of Plastic Surgery B. Today we make a review about a very interesting subject, so stay tuned. Thank you.
Hello again, guys. Today we review the breast augmentation, pocket irrigation, and implant bathing. And we will check like both schools, both opinions, both major opinions. So first of all, I need to share one very useful website that I have found called the savebreastimplants.org. And they have a scheme or a plan made of 14 points that makes your breast augmentation surgery using the silicone implants much safer. So they have recommended that use of intravenous antibiotic prophylaxis, avoid periareolar incisions, use nipple shields, perform pocket irrigation with correct proven triple antibiotic solution or betadine. This will be like one major part of our discussion today. Minimize skin implant contamination using the funnels or the sleeves. Minimize the time of implant opening, repositioning, and replacement of implant or sizers. Perform careful atraumatic dissection. Perform careful hemostasis. Avoid dissection into breast parenchyma. Use a dual plane pocket. Change surgical gloves prior to handling the implant. Avoid using a draining tube where possible. Use a layer closure of your wound. And finally, use antibiotic prophylaxis to cover subsequent procedures that breach skin or mucosa. So this website actually belongs to Integrated Specialist Healthcare Education and Research Foundation. I found this checklist very important. So today we will go more through discussing the rule of breast augmentation, pocket irrigation, and the silicone implant bathing. Is the science behind that, and what will be our final verdict? So first of all, I just need to share one very interesting paper with you titled Characterization of the Microbiome of Nipple Aspirate Fluid of Breast Cancer Survivors. So actually in this study, the sample wasn't made only of breast cancer survivors, but also had healthy ladies. And actually the results are really mind-blowing. So they found out that when they took a biopsy from the nipple skin, so they found that it has a microbial composition made of this very long list of microorganisms, as we can see in this diagram. Actually, when they took the nipple aspirate fluid microbiome composition, so they found another long list of microorganisms. And the most mind-blowing thing, after they have disinfected the skin with betadine and povidone iodine, they have found still this long list of microorganisms. So that's why here comes the importance of using the nipple shields during surgery, and avoid as much as you can, of course, the periareolar incisions. There's another study, another publication that is titled Risk of Breast Implant Bacteria Contamination from Endogenous Breast Flora, Prevention with Nipple Shields, and Implications for Biofilm formation. Actually, in this study by Wickstrom and others, after they did like a number of breast augmentation surgeries, after finishing the surgery, they removed the nipple shields and they swabbed the area, and they could isolate, as we can see, normal skin flora, Staphylococcus epidermidis, coagulase negative Staphylococcus species, and Probionobacterium acnes. Actually, moving to, is it okay to bathe my silicone implant in like saline or in betadine or a triple antibiotic? So there was another study, and I can describe it also as a mind-blowing one, that took brand new unused sterile breast implants. They didn't define like the brand or anything, but they swabbed the shell from the outside and the gel inside, and the mixture of both of them, and surprisingly they could isolate, as we can see on the big red circle, inside the big red circle on the left hand, those numbers of bacteria. On this study I found also another very interesting term called the vulcanization. So it's kind of a process that happens to each and every silicone implant, in which they mix the rubber or the silicone with sulfur under high temperature, say 140 to 160, which gives the rubber or the silicone more elasticity and resilience. As we can see, there is a big relationship between the biofilm, the bacteria infection, and the capsular contracture. So all of the studies that we will discuss in the coming slides, it will be reflecting between those three aspects. As we can explain very easily and very shortly, the biofilm, as I found a very interesting definition, very simplified, that is the house or the cities for the microbes. So it is just an extracellular matrix full of like glycoproteins and other substances in which the bacteria and the flora are swimming. Okay, and in this photo here, we can see an electron microscopy photo of the biofilm, those threads, while those circles or globes, these are staph actually, and they could find that on an indwelling urinary catheter. So looking at the studies that goes for or with and against the breast augmentation, pocket irrigation, and the silicone implant bathing, we can see that there are several studies that are with that practice, like the capsular contracture, a prospective study of the effect of local antibacterial agents, and this is one of the earliest studies actually that was written by Burkhardt and others. It was, I think, in the mid 80s. Also, optimizing breast pocket irrigation, and in vitro study and clinical implications of optimizing breast pocket irrigation, the post betadine era, protective effect of topical antibiotics in breast augmentation. And as we can see, you can look for that later, that you can see similar names from a study to a study. That means that there are scientists and plastic surgeons that adopt the idea and they are trying to defend it fairly, of course. So other paper, efficacy of vancomycin-based continuous triple antibiotic irrigation in immediate implant-based breast reconstruction by Hunziker and others, reducing infection risk in implant-based breast reconstruction surgery challenges and solutions by Owi and Song, efficacy and safety of povidone iodine irrigation, reducing the risk of capsular contracture, which we have just agreed on the biofilm and the infection and the capsular contracture will be three aspects of the same coin if that applies. As we can see, povidone iodine combined with antibiotic topical irrigation, and the last one, enhancing patient outcomes in aesthetic and reconstructive breast surgery using triple antibiotic breast irrigation, 6-year prospective clinical study. So all those studies that have the green thumbs up, they were for or with the breast augmentation, pocket irrigation, and the silicone implant bathing to prevent the biofilm formation or the infection or the capsular contracture. So actually, sometimes I find colleagues, like, they do not even touch the implant. They just, just throw it into the sleeve of the funnel and they just insert it immediately. Some of them, they bathe it in saline. Some of them bathe it in betadine. Some of them bathe it in triple antibiotic mix. Some of them went to the extreme, and before opening the last or the final packaging of the implant, they stick a needle inside this packaging and they inject triple antibiotic around the implant, pretending that this will create a positive pressure inside this last packaging that will never let bacteria from the outside into the inside of the package to be on the surface of the implant. And I'm so sorry, I doubt about that. So let's say, is it harmful for the breast implant surface or material to be disinfected or bathed in any kind of solution? So people who made studies about that, there were actually two studies that I found. So the first one is short-term intraoperative application of disinfectant harmful to breast implant And this study by Schmitz and others, they didn't find any impact on the integrity or the wellness of a breast implant. The other one was the rule of betadine irrigation in breast augmentation by Wiener, Professor Wiener. So in this study that was in 2018, I think, they didn't find any relationship between bathing your silicone implant in betadine or in other disinfectant solution and the integrity of the silicone implant shell. This whole thing came from the FDA because when they were giving the clearance or the permission for a certain brand, actually it is the Natural by Allergan, they have warned that using povidone iodine with this implant may damage the shell of the implant. But actually, most of the people just forget the fact that in 2017, FDA itself, they have declared that they are canceling this warning and it is more than safe to use the betadine or the povidone iodine to disinfect or to bathe your silicone implant. So actually, the website that we took the 14-point checklist from, they are having a guideline for the cocktails. As we can see, like some of them are just based on betadine, cefazolin, gentamicin, and saline. Some of them are just betadine and saline. Some of them pestracine, cefazolin, gentamicin, and saline. And as we go, you will find like endless recipes, if we can call them, or cocktails, okay, from different sources and from different papers. This one is from the most detailed ones that tells you about the irrigation method, the intraoperative irrigation, like the formula itself, the systemic pre-operative and post-operative antibiotic before and after the surgery. Even there were 2 studies that I found from the previous sources that were with irrigation of the breast implant pocket that suggested mixes or recipes or formulas for people who are allergic to one of the components of the main or the well-known formulas. So people who have allergy from the iodine, from the beta-lactams, from the bastracine, from the aminoglycosides, and so on. So they have suggested replacement formulas. So for the papers that are against the breast implant bathing and the breast augmentation pocket irrigation, so you can see several papers like revisiting term antibiotic irrigation breast implant pockets, examining the role of antimicrobial irrigation and capsular contracture, evaluation of antibiotic irrigation versus saline irrigation. And as we can see that the gentleman, Professor James Drennan, he's in the first 3 studies. And that emphasizes the fact that some scientists or some plastic surgeons of the major names, they are trying to adopt and trying to research into one direction if this protocol really works or doesn't work. Antibiotic irrigation of pocket for implant-based breast augmentation and the rule of triple antibiotic saline irrigation in breast implant surgery by Campbell. And all those papers were against the principle, or at least they said that there's no solid evidence that they could find. So in this very interesting book that is entitled Disinfection by Sodium Hypochlorite Dialysis Application, so they have enlisted the medical devices that are associated with biofilm formation. As we can see, the list is very long, and one of them is the breast implant. So this idea came to me, and I thought, what if I go a little bit through the other subspecialties of surgeries, and let's see what other people, what other surgeons think about different body implants. Do they disinfect them before implanting them? Do they disinfect or irrigate the cavity or the pocket of whatever the organ is? And I looked and I thought, I said, like, breast implant, they are important. Everything, the health and well-being of our ladies is the most important thing, but they are not critical. Like there are other implants that have much more importance. Just like, for example, like the intracranial valves, the artificial cardiac valves, the penile prosthesis, for example, like those things, they really save lives. So as we can see, I took screenshots from different surgeries. The first one on the left up there is of credits goes to Dr. Bulent Unal, and he was implanting an intraventricular or intracranial valve that will drain the high pressurized CSF. In the photo to the right in the middle, and credits goes to Cleveland Clinic. So the surgeon, the cardiac surgeon, was implanting an artificial cardiac valve, and he was replacing the aortic valve, and he was holding, as we can see, holding the valve by his gloves, bloody gloves, okay, and with blood on. So, and the third one, and credit goes to Dr. Andrew Kramer. He was implanting a penile prosthesis, and as we can see, he was holding the implant in the surgery, during the surgery, just using his gloves. So I thought that I should look through the literature if I can find any recommendations for those kinds of surgeries. So actually, I have found that yes, the pocket irrigation and bathing your implant wherever it is in the body, actually there is literature behind them, and other surgeons from other specialities, they do it. So actually I find I have found one publication by J. Patrick Self and others, and Coley Carson, that is talking about penile prosthesis infection approaches to prevention and treatment. And actually I found a very interesting product called the Inhibizone, and this is a penile prosthesis that is coated with antibiotics that is does sustained release of the antibiotic in the first few hours after surgery, that protects against infection. And it came to my mind that one of our major breast implant, silicone implant companies should adopt the idea and produce for us breast silicone implants with an antibiotic coating around them. I know it would take time, but it's a very interesting idea. Then I found by Musa and Mohammed efficacy of post-operative antibiotic injection in and around ventriculoperitoneal shunt and the Sunrise protocol to reduce cerebrospinal fluid shunt infection, and they are doing the same thing. They bathe the implant and they make sure that the pocket that they will insert the implant to is completely sterile, and they use antibiotic irrigation, everything. So at the end, you have to choose one of both ways. Either you think that if you irrigate your breast implant pocket and bathe your breast implant into like a disinfecting solution or antibiotic mix, maybe there's science behind it, and maybe it's just like feeding our OCD part or used by other people as a publicity tool into the social media. So my advice is to be very flexible. Like if this presentation changed your mind, you have to change it, actually. Thank you so much for listening. Message us, follow us on Instagram, watch us on YouTube. Apis debemos imitari.